Good night all. We from Group 4, which are member of Sayogi Priambodo, Saradiani Gusti, and Silviani. We'll present about diabetes mellitus exercise. Next slide. Definition. Diabetes exercise allow impact and rhythmic exercise. This diabetes exercise lasts 30 minutes with a frequency of 3 until 5 times per week. Unhealthy lifestyle such as obesity, lack of physical activity, and consumption of low fiber foods will exercise the risk factor for DA. Next slide. Diabetes gymnastics is specifically shown to people with diabetes where two movements are fun and not boring and can be followed by all age groups. Patients who have experienced chronic complication of diabetes mellitus will have impairments at quality of life. Controlling blood sugar levels can be done by changing a healthy lifestyle and regular physical exercise. Next slide. Physical exercise for people with diabetes mellitus. Proper physical exercise for people with diabetes mellitus must pay attention to 3 things, namely 1. Exercise frequency. The frequency of exercise is physical exercise that is done 3 times a week and gives a pretty good effect. 2. Exercise intensity. The intensity of physical exercise is determined based on the determination of DNM or maximum pulse rate. First, in each time physical exercise should reach 72 until 87% DNM. Next slide explains Sylvie.
3. Practice time. The recommended duration is 50 until 30 minutes each time you exercise. Diabetes mellitus patients should do physical exercise no more than 60 minutes because it can cause hypoglycemia. Benefits of diabetes exercise. 1. Lower blood glucose level and prevent obesity. At rest, muscle metabolism requires only a small amount of glucose as an energy source. But during physical exercise, glucose and fat are the main source of energy. 2. Suppress the occurrence of the complication or blood lipid disorder, fat deposition in the blood vessels, increased blood pressure, blood hypercoagulation, or blood collection. Indication and contraindication for diabetes exercise. Indication. Diabetes gymnastic can be given to all diabetes mellitus patients. Contraindication. 1. Patient experience change in physiological function such dyspnea or chest pain. 2. People who are depressed, worried, or anxious. Gymnastic diabetes, warming up while standing in place. Raise both hands up at shoulder level, hand intertwined. Warming up to stand in place, raise both hands in front of the body until they are straight. Then move both fingers as in to squeeze. Then open wide. Do it alternative, but the hands are raised to the right and left or the body until the shoulder are straight. Next, Sayogi.
Care 1. Standing position straight. Right foot forward a step forward, left foot in place. The right hand is raised to the right of the body at shoulder level, while the left hand is bent until the hand approaches the chest. Do it alternately. And care 2, the standing up position is straight. The right left is raised, raised until the thigh and calf from an angle of 19 degrees. The left foot remains in place. The right hand is raised to the right of the body at shoulder level, while the left hand is bent so that the pen is close to the chest. Cooling. Right hand slightly bent, left leg straight. The left hand is straight forward at the shoulder level. The right hand is bent inward. Do it alternately. The position of leg in the shapes of level. The latter is upside down, but hands are stretched upward to from the level. The latter. Thank you for your attention. Okay, I will give an example of diabetes mellitus exercise. And the first is warm up movement.
Yuki mukanya nggak kelihatan.
Ah, mukanya nggak kelihatan. Ah, dia nggak kurang tinggi ya. Astaga, ya baik teh. The first warming up. And then and the second is a care movement. And the third is a cooling mention. Okay.